Hi, my name is Maria Vandross, and I'm a registered nurse. I am a registered nurse at the East General Hospital in Toronto, Ontario, Canada, and I work in the operating room. I see patients coming in every day having surgery for diverticular disease. There's two categories, diverticulosis and diverticulitis. Now for this disease, the diverticula is an outpouching of the mucosa of the inner lining of the intestinal wall. Diverticulitis is inflammation of these pouches, and diverticulosis is merely just the presence of the pouches in the intestines. Although this disease can happen anywhere in the GI tract, it's commonly found in the sigmoid colon. Signs and symptoms for diverticular disease is not usually present for patients with diverticulosis. However, with the presence of infection in diverticulitis, signs and symptoms such as abdominal pain in the lower left quadrant is present. Now this pain can be subsided when the patient releases gas or when they have a bowel movement. Other signs and symptoms include chills, fever, and even anorexia and nausea. There's no known cause for diverticular disease. However, because it commonly happens in the sigmoid colon, some people believe that it is because of the smaller diameter of the sigmoid colon, which causes an increase in intraluminal pressure. Some people experiencing some of these signs and symptoms go to their general practitioner. The general practitioner can help diagnose the patient by doing a fecal occult blood test to see if there's any presence of blood in the stool. As well, the most accurate test to be done is a CT scan of the abdomen, which has a 98% accuracy rate. To treat diverticulitis, a patient is usually prescribed an antibiotic such as Cipro, Keflex, or Flagyl, as well as increasing their IV fluid intake and a bowel rest, so the person may be NPO, which means that they're not having anything by eating, by their mouth. As well, people suffering from this abdominal pain and constant irritation and attacks may have surgery for this. Surgery consists of resection of part of the bowel and as well sometimes a creation of a colostomy. Although the surgery is elective, many people decide to have the surgery just to relieve the pain and reverse all of the attacks. To have this surgery, a patient, it needs to depend on the stage of the disease, age of the patient, frequency, and severity of the attacks. However, although these surgeries can be elective, in some cases they are emergent. For patients with a perforated bowel, it becomes emergency to have a part of that bowel resected in order to prevent sepsis and infection.
Hi, my name is Nicole, and about a year ago, my uncle was diagnosed with diverticulitis. By the time of his diagnosis, the infection had already spread throughout his small, large intestines, his stomach, his kidneys, and his liver. And up until then, he had never really been sick before. But thanks to the help of all the nurses and the doctors, he has made a full recovery. Except I don't think he's ever really going to be the same, because he has this really gross colostomy bag coming out of his abdomen, and I just don't like looking at it. So anyways, learn from my uncle and recognize the signs and symptoms.
Hi, my name is Jessica and I'm 24 years old and recently diagnosed with diverticulitis. It's pretty uncommon for people my age and embarrassing to talk about. At first, I ignored all the signs and symptoms because I was hoping that they would pass, but eventually I had to see a doctor because I just couldn't take the pain anymore. I never imagined myself having to be on a schedule for medications, but after 2 months of being on antibiotics and heartburn medications, I'm happy to say that I'm no longer in pain.
Do you wake up in the middle of the night suffering from heartburn? Were you recently diagnosed with diverticulitis? Prevacid may be right for you when diet and exercise doesn't work anymore. It is not for everyone, including people who are pregnant, may become pregnant, or breastfeeding. or for those that have allergies to Prevacid. So go ahead, tell your doctor and pharmacist if you're taking any other medications, or if you have any chest pain, headache, dizziness, or any abdominal pain. This may be a sign of a rare or serious side effect. So go back to having a regular restful sleep without heartburn and without abdominal pain, because you deserve a restful sleep.